All right, so I wanted to have a discussion here in studio in regards to this latest developments. Joining me right now is Andrew Mulwa, who's the chairman of the Council of Governors Health Caucus. Thank you so much for joining us on News Center. So first things first, Kenyans are wondering, why is this taking so long? It is now 60 days of Kenyans not being able to access healthcare.
First, I would like to say thank you very much for the invitation to the studio. It's very, very unfortunate that for the last 60 days, Kenyans have been unable to access health in the public health sector. This is not to say that nothing is happening, absolutely. You remember, Betty, on the 5th of December, there were two strikes, a strike for the nurses and a strike for the doctors. We were able to resolve the nurses' strikes on the 14th of December, which is about 8-9 days into the strike. The doctor strike has, however, continued. And it's very unfortunate that this has continued. No amount of excuses from either the government side or the union side can justify the suffering that Kenyans have continued to go through for the last 60 days for lack of proper health, so to speak. Negotiations, and on the part of government, we have continued to exhibit goodwill to negotiate with the union. And the matter in contest is the CBA, the collective bargaining agreement, that was signed on the 27th of December of June 2013. And there are many issues about the delivery of health in that document. And as government and as union, there is no contest in most of the issues that touch on service delivery, whether hiring of doctors, infrastructure development, provision of equipment, training, all those issues are not in contest. The main issue that has been contested is the issue on pay or remuneration for doctors. Of course, there was a Schedule A in that document that had given proposed pay for doctors. Before any commitment is made by a government to pay new salaries, we need to take in the input of the Salaries and Remuneration Commission, which is a constitutional body established to advise on payment of salaries for state and public officers. The National Treasury also must be brought in so that...
But haven't they been part of the process since 2013?
So that they advise on the fiscal space that as a country we have. Because much as I am a doctor myself, much as I want to see doctors of this country paid the amount of money that they are asking, I am also a doctor. I also want to earn that money. We must also be realistic that this money comes from people's taxes. And there are national priorities. We have education, we have health, we have infrastructure. We have so many national priorities that must be met. So it's a question of how much is it feasibly possible to commit salaries at the expense of other national priorities. And there was an offer from government. In fact, so to speak, His Excellency the President was involved, and he gave an offer to the doctors that new doctors who are just graduated from medical school, interns, move from job group L to job group M, and with some increase in some allowance, so that an intern takes home, gets a gross salary of about 196,000, and also an offer to increase, to move every doctor one job group higher, so that we accommodate the promotion of interns from job group L to M. And that is the offer that has been on the table.
But the doctors say that it's too little.
Betty, I mentioned 196,000 as the startup gross salary for an intern, someone who is just freshly graduated from school. Betty, about 8-9 years ago, I was an intern, and my gross salary was 56,000. So, of course, that is not enough, but we are progressing. We can engage in a negotiating table because we are talking about a limited fiscal space. This money that we are asking for is the tax that we pay.
So now what's the way forward, really? Because the doctors seem very, they're so solid in what they want. And they're not, it's 60 days. I mean, if it was going back, they would have gone back already. So what's the way forward? As government, what are you offering? What are you telling Kenyans today?
I think, Betty, as a government, both national and county governments, we have been very consistent on this matter. You've not heard us come to the media and say these doctors are wrong, what they're asking is unreasonable.
Right.
We have tried to keep some level of understanding because we want to exhibit utmost good faith as we negotiate.
Right.
Solutions can only be got from the negotiating table. We ask the union with utmost goodwill. And it's unfortunate, and I'm not allowed to talk about matters of court.
Yes.
It's unfortunate there are court issues that are also hovering around the strike, and that has made the things a bit complicated so that the unions look at us as government like not exhibiting utmost good faith. But the reality is there is a difference between the court process and the negotiation process.
All right,
and of course, you will not easily say this and be accepted to the doctors but we continue to want to continue engaging. One thing is if we are, because on the part of the union, and I've been a member of the union, a founder member of this union, I've been working, I at one point worked as a branch chair, Eastern region of the union. So, and it's unfortunate now I'm on the other side. The union that I helped form is now I'm on the other side. It's very unfortunate. Although it gives us an understanding that we can still engage. I understand where the doctors are coming from. We understand where the doctors are coming from. Let's come to the negotiating table. Can we stagger this demand that the doctors are put on the table?
All right.
Can we agree on the issues of, like, this CBA was signed in 2013. Can we agree on a CBA that moves from 2013 to CBA that moves from 2017 to 2021 for 4 years?
All right.
Can we agree on the issues that we cannot implement this CBA in retrospect? These are the issues that need to be honest. And as far as I'm concerned, the issue that is in contest should not necessarily, whether it's utmost good faith, should not necessarily take more than 2 hours. It's an issue that we need to sit.
Okay, more than 2 hours.
Good faith, 2 hours, we dispense the matter.
Let's talk about this. The Council of Governors say that they are against, the Ministry of Health hiring new doctors. I mean, that is just one solution that is being fronted out there. Don't you think that it is pretentious of the Council of Governors not to say don't hire new doctors, yet there's really no solution seemingly at hand?
First, I'm not sure the Council of Governors is against hiring of new doctors.
Well, there was a statement.
The statement was not about the doctors. You see, the health professionals are many. They are nurses, they are clinical officers. And as far as I'm concerned, the issue that was being contested, the issue of hiring of nurses and clinical officers by the national government to run county facilities. Because the Constitution of Kenya in Article 6(2) is very clear that Article 6 is very clear that Kenya is divided into 47 territories and has 2 levels of government, national and county. And each of these governments have their own functional functions as stipulated in Schedule 4 of the Constitution. So the national government in health has the responsibility of national referral, capacity building, issue of national health policy. Broadly speaking, those are the functions of the county government. Issues of service delivery are functions of the county government, and that is clear. And I personally, because I don't believe there is a matter that we would say there is a contest. What is there? There is no proper institutional understanding between the national government and the county governments. There are intergovernmental mechanisms that exist if national government has a program that they feel they can collaborate, because the Constitution says national and county governments collaborate through mutual understanding and cooperation. So it is that mechanism that has not been triggered, so that if the national government, and there are these mobile clinics.
Yes, the mobile clinics.
Not
right.
mobile clinics per se, but yes, container clinics, let me call them.
Yes.
100 of them, they will require staff to run them. Delivery of health services, this is a noble idea. The clinics is a noble idea. When you go to places like the informal settlements, you go to places like Kibera, you go to places like Mukuru, it is, Betty, it is impossible to have a health facility with all those space that is required, because those areas that, and we need these people to have access to health. So you can have a mobile facility that can be delivered in any open space within the areas, have commodities, have a clinician or a health worker to deliver health services to those communities.
Right.
Increasing access, it's a noble idea.
Okay.
But this is a function, service delivery is a function of the county government.
Right.
So we need to have an intergovernmental agreement mechanism, which has not been signed as yet, so that we, county governments and national agreement, have an agreement that we are going to take up these clinics, and in that agreement, we can agree. The national government can will engage, and we know after the end of these 24 months, which these healthcare workers are being engaged, what is the transition mechanism, so that we don't have these health workers for 24 months, we increase access to health services, and it becomes a burden of the county. We must also look at this. So I'm thinking about this is, to me, institutional mechanisms that have not been triggered properly, so that this thing is clear.
But it sounds really bureaucratic, Andrew. That's the other problem with, these processes, especially that involve the national government and the county government, that, the Kenyans need this healthcare really, really fast. But then you find that there's so many issues that come across or come in between, such that it takes so long to deliver these services that you're talking about.
Betty, shouldn't take long, because I'm talking about we have intergovernmental forum, like for the health sector, we have intergovernmental forums, like every other month. Every time there's an issue that needs to be dispensed, we are able to convene ourselves within 7 days and have a meeting. Sometimes even within 3 days, have a meeting, dispense issues. We have an upcoming intergovernmental forum. This will sit at the health sector, national government, county government, then advise the council of the governors, council of governors, and advise the summit. Then the matter is taken and we agree. So it's a question of this mechanism has not been agreed, and what I find is probably the advertisements that, not probably, the advertisement that ran on hiring of this staff should not have preceded the agreements. The agreements should have been made so that as we go ahead and advertise, it is clear to both the county and national government what is the mechanism. Because we could still have other arrangements which are subject to discussion. We could have these monies given to county governments as conditional grants for hiring of staff. Which there are many other mechanisms that can be employed. So that is not what is in contest. It is I look at it as institutional administrative mechanism, not properly triggered.
So let's go back to the bigger issue, which is the doctor's strike. Currently, as we speak, whose court is the ball in right now to ending this doctor's strike? Because the doctors that really, the union has been busy attending court sessions. So right now, as we speak, whose move are we waiting for?
Betty, I'm supposed to be working in Makueni today. I've been in Nairobi on these negotiations. Trying, as the chair of the CECs, I've been spending a lot of days here in Nairobi trying to get to the negotiating table, talking to the doctors and see whether we can reach a solution for the last, from the 5th of December. Like I began, it's unfortunate that this has continued to drag for far too long. I believe, and the Council of Governors passed a resolution that because we treat this as officers who have absconded duty. Of course, Kenya has a gross shortage of doctors, and there is a reality that we face, that there is brain drain. Many doctors are leaving the country and going to serve in other countries. The fact is we may need to think as Kenyans, and I've been asking myself this question. What are the opportunities that this strike is bringing so that we truly and for posterity address the issue at hand, so that after this strike we do not have other strikes and have a doctor who is satisfied, have our patients are satisfied, and improve the infrastructure and everything that is happening. And Betty, county governments from their existence, in fact, this has been talked in this studio, has been talked all over the media, that county governments have invested a lot in health for the last 4 years. Of course, industrial action has been our biggest undoing, that there is a strike in one county or another, like every other day, meaning we have not been able to address the issue of human resource management properly, which is, when I read about all the countries that have had devolution of health, the last person to be properly devolved or to accept devolution is the healthcare worker. So it is not a situation that is peculiar to Kenya. When you look at Mexico, when you look at Indonesia, when you look at all these countries that have done their devolution, this has been the story. But that notwithstanding, everyone has a responsibility. There is a moral issue that I always talk about. Stop being a doctor. Stop being a government official. Is it right for Kenyans to continue suffering?
But the issues are issues.
Is it, how many, should people continue dying because you need to be paid a big salary?
But issues are issues.
And every time KTN plays the doctor strike, if you are careful enough, you will see a clip that I'm leading the strike. I'm leading the strike in 2011. Even that time, Betty, I used to lead the strike here in Nairobi, do our street demos, but every time there's an emergency, I was available to serve the people of Machakos, to serve the people of Makueni. So what I mean is this has protracted for too long. I think the doctors have a moral question to ask themselves. Should Kenyans continue suffering?
But
Should they come back and, even as they continue to agitate for their pay, can they come back and offer emergency services so that we are at least sure people don't die? Because emergencies are emergencies.
But the government still has to do its part, right?
Yes. The government part is create an enabling environment. These are employees of the county government, of the county and national, of the government. So even as they agitate for their pay, we need to think about the people who are suffering. Unfortunately, our relatives.
All right.
Our brothers, our sisters,
we'll
our
have
parents.
to end it there, but the government, as much as, doctors are human beings, at the end of the day, they should offer services. They are agitating for what's rightfully theirs, what the government agreed upon in 2013.
Betty, and I do not want to go into these details. There are many questions that we can ask, and I don't want to go that route about what is the legal standing of this CBA. I am not a lawyer, but I at least know when this CBA was signed by the then PS, Public Health and Sanitation, there were two ministries of health, if anything. And the Ministry of Public Health and Sanitation had about 300 or 400 doctors, while the majority of the doctors were in the Ministry of Medical Services. The PS Ministry of Medical Services did not append signature to that document. That leaves questions. Why? Why didn't the PS Ministry of Medical Services append the signature? Then the other thing is, so this CBA, if we were to strictly follow its operation, we would say who are working with the Ministry of Public. I don't want to go there. The other question is, the Constitution of Kenya, 2010, was promulgated on 27th of August 2010, was in force. There was an entity called county governments when this thing was being signed. There was no way a national entity, whether gazettement of devolution of devolution of function had been done or not, a national entity would sign a document that confers responsibility to county governments. That's why I exist in that. I don't want to go into that discussion.
All right. Yes,
because we will arguments are arguments. Position are positions.
Yes.
But the facts are facts that Kenyans are suffering.
Kenyans are suffering indeed.
Yes.
Kenyans are really suffering, and that's
Yeah.
That's the true issue, even with all this back and forth, that's the issue at hand.
Yes.
All right, thank you so much, Andrew, for your thoughts. Andrew Mulwa is the chairman of the Council of Governors Health Caucus. Thank you so much for your time here on News Center. All right.